His video is really hard to watch. It looks like she's being held down and the nurse actually looks annoyed. It would have been better for her to listen to her body, to get up and move into different...
The first time this video came out, I just ignored it because I felt like it would be a landmine to respond to it. But now that it's coming back up, I feel like I should weigh in. There's a lot of assumptions that were made when people commented, including in this stitch that I included. And I have a completely different perspective. So as an OBGYN, I've been in this situation many, many times. So of course I'm going to make my own assumptions, but this person right here is not a nurse. This is a patient's family member. You can tell because of how she's dressed and her mask. The patient is pushing her away because she's in so much pain and grabbing at anybody who's around. This nurse right here is also not holding her down. She's actually trying to hold her leg back so that she makes space for the baby. There have been cases where patients have squeezed the head of the baby as it was coming out because they would not open their legs, right? So your natural instinct when you're in a lot of pain in that area is to close your legs and pull away. That happens in labor. It happens when you get a pelvic exam. That's just what happens. I don't think she's looking annoyed. I think she's struggling because if you need proof that women are the strongest beings on this planet, deal with a woman who is going through an unmedicated birth. Those legs are really hard to hold back. Back to this assumption that this patient desired an unmedicated birth. I don't think she did. And when you are not mentally prepared, when you don't have that mindset, you don't want to get up and move around. There's always this, well, she should have been allowed to get up and follow her body. I have offered patients to push in different positions, and they look at me like I'm crazy. In my experience, for patients who had no intention of having an unmedicated birth, they either end up like this on their back or in all fours. Videos like this can be triggering for a lot of people because a lot of people have had, bad things done to them surrounding their birth. But I think it does a disservice to put these videos out there, one, with no context, and two, to put our own feelings, our own biases, our own assumptions on these situations, and then just state it like it's fact and state it to push your own agenda. And I know it's everybody's right to share their birth experience and stuff like this, but I wish people would just stop posting these videos on the internet because it just scares people who are pregnant, who are thinking about becoming pregnant, and it triggers people who have had birth trauma, right? So, I mean, like I said, it's everybody's right to share, but I wish we would think about our fellow person in these situations because it can be very traumatic.